Hi, I'm Dr. Chris Baker. Today I want to talk to you about sagittal correction because when I was practicing orthodontics in Abu Dhabi, United Arab Emirates, I was most honored to speak at a CE course with the inventor of sagittal correctors, Dr. Louis Carriere, on treating with these appliances in mixed transitional dentition. That was my part on the program. I was also very fortunate to be treating hundreds of patients quite successfully, and was I thrilled, in both mixed and permanent dentitions with these appliances. And I was further fortunate then to be on stage with Dr. Carriere in Dubai to teach what I was doing in transitional dentition. In my practice, as I began to see the wonderment, yes, I say wonderment, of these appliances, I absolutely had to create courses for doctors, for you, because we all know how challenging the Class 2 and Class 3 patient treatments can be. For many reasons they can be, of course, not the least of which is compliance and bulk of appliances and discomfort and length of treatment time and lack of success. Realistically, think about it. So we did create just that, courses in the clinical use and results in the use of these appliances. Now, this year, let me tell you, AAO awarded Dr. Carriere the Golden Molar Orthodontic Award during the AAO annual meeting in Chicago a few days ago for the Carriere Sagittal Corrector. The history, this is interesting. Some years ago, Dr. Louis Carriere invented this fixed appliance for sagittal correction of Class 2 and Class 3 malocclusions. Initially, I learned about the Carriere appliance, as he called it then, through Lindsay Brem, then founder and president of Ortho Organizers. Dr. Carriere lectured for us at the American Orthodontic Society several times, and here we had at our disposal either yet another Class 2 device which had some benefits with many cons, downsides, as you have experienced, I'm sure, on some of these appliances, or we had a new appliance that allowed efficient, quick and effective correction of posterior occlusion with gorgeous changes in the precious faces of our patients, improved inter-arch relationships and occlusion, improved finish with many less negatives than any of the many, and I do mean many, appliances we had all used to date. If you're anything like me, quite a few different ones. Eventually, Ortho Organizers was sold to Shine, who now represents Dr. Carriere and sells his sagittal corrector, now been renamed for several years the Motion Appliance, good name, and Lindsay Brem has manufactured, guess what? A sagittal corrector called the D2 appliance. These appliances are absolutely amazing, with amazing and wonderful potential and wonderful results. I think the most amazing thing is the concept that Dr. Carriere put forth when he began speaking about his appliances. Sagittal first. Suddenly, we were looking at the possibility, was it a good idea, of correcting the Class 2 or Class 3 posterior occlusion first, not level and aligning, first before expansion, first before alignment, first? And guess what? Yes, that is an amazing and solid way to treat orthodontically. Really, it's incredible. Now, after using these appliances, first the Carriere Motion appliance that I had learned, and then and now also the D2 appliance, I am over the target, as they say, as a believer. In my opinion, there is no better way to treat a Class 2 or Class 3 patient, bar none in most cases. Let me just give you some can you imagines. Let me show you what I mean. Can you imagine completing the Class 2 or 3 occlusion correction in 4 to 6 months, the posterior occlusion? Can you imagine The appliance is comfortable. Can you imagine that the treatment time with the sagittal corrector is shorter compared to elastics and other appliances used to work toward the class 1? As you correct the class 2 or 3 in only a few months with sagittal correctors? Can you imagine, think about this one, not having to prolong the treatment plan, the treatment timing for a reticent patient and by then parent, while you're encouraging 24/7 wear, which I'm sorry, but you won't get it. And finally, give up and rationalize to yourself and the parent, you've tried and tried, so it's time to get out. You know what I mean. Or worse, some patients and parents do not even know that their treatment, that their child's treatment, their occlusion has not provided the class 1 intercuspation goal that you set for their treatment, and you should. Can you imagine limiting the need for extractions, which are not always nice for the face, much nicer smiles and faces in most cases? Here's another can you imagine. Can you imagine not delivering brackets until after sagittal correction, unless, okay, if you deem it beneficial to utilize some incisor brackets, say during the sagittal correction phase, and it might be. Beneficial like how? Well, because of aesthetics and patient joy, that they have straight teeth in their feeling. Beneficial because of closing spaces or correcting crowding to aid in eruption. Beneficial because the adolescent permanent dentition or adult patient wants to shorten their treatment time as much as possible. So yes, let's work on the posterior occlusion while we correct the alignment. Can you imagine the uniform force for distal molar movements with controlled rotation and tipping correction before other appliances are even placed? Dr. Carrier is most deserving of the AAO Award of Honor for his creative development. Certainly, I have seen it change so many of my patient lives. And you know, this is for a lifetime in most cases. It makes our orthodontic treatments quicker without downside to that speed and better, and that is wonderful. You can take an ADA CERP course at drchrisbaker.com, our website. In fact, you can take both. First, do the sneak peek 2-hour course. Then do the full course to get all the details. And share that with your staff so they can support you in your amazing successes in sagittal correction in class 2 and class 3 cases. drchrisbaker.com for your free sneak peek course. That's where you can start if you like. Learn the pros and cons of the 2 appliances on the market. There are some slight differences for you. And the motion appliance in D2, you can choose wisely for your patient each time. In the full course, I'll tell you how to go ahead and achieve 99% compliance. Now that's a biggie with those necessary elastics they have to wear. Let me give you some hints. It's only for a few months, unlike traditional elastic wear. You're only working to reposition posterior teeth. You're not trying to move the full arch with the elastomeric forces. Neither the patient nor the parent nor you are in fatigue mode in the treatment. Think about that one. That's a biggie. This is the time when the patient and the parent are most motivated. They're most compliant. A fresh and willing patient and a fresh and willing parent, because that helps with the youngsters. If it is a youngster, they want their colors, right? If it's an adolescent, they want to get the braces and get done. You can do it either way. We'll talk about it. Deal, can do. As soon as the sagittal correction is done, voila, we keep going on and finish up that case in short order. Remember, sagittal correction first. Then expansion, if it's indicated. Then and a level and alignment. and finishing the case way before you would typically finish any Class 2 or Class 3 case without your sagittal correctors. Happy patients, happy parents, happy doctor. Let us know how we can help. Go online, drchrisbaker.com, check it out, contact me, contact us for any help that you need. We look forward to sharing it with you.